Why do I have arthritis? That's a really common question we hear in clinic. Hello, my name is Dr. Amit Atrey. I'm an orthopedic surgeon and I specialize in hip and knee replacement surgery. Let's discuss why you may have arthritis and, more importantly, what we can do about it. Why do I have arthritis? Well, the short answer to this question is we still don't fully know. Osteoarthritis is definitely more than just simple wear and tear. You may have friends who have run marathons or who do physically demanding jobs but never develop arthritis. And then there are those people who have office jobs or who haven't done anything sporty and they are getting arthritis. It doesn't make sense, does it? It isn't fair. So what does cause arthritis? Well, researchers think maybe many years ago, you may have had a really small injury, an awkward twist, a tumble that you barely noticed. And that may have caused a tiny tear in the cartilage. Over the next few years or decades even, that micro tear may have gotten bigger and bigger until it took out all the cartilage. That means cartilage wear develops over a long period of time and maybe even over decades. Alternatively, you may have relatives who've had joint replacements. So we know there is most likely a genetic, or that means a family connection to developing arthritis. But there's also probably a change to the chemicals in the joint that happens as we get older. So we think arthritis is connected to three things. Probably some trauma, probably some family risk, and probably a change in the body as we get older. What can be done for arthritis? Your surgeon will speak to you about the non-surgical options, and you should definitely try some physiotherapy first. The evidence is that physiotherapy can slow down the need for surgery. Even if it doesn't help with your pain, it will help with you preparing for surgery if you do need it. If you're overweight, you should do your best to lose weight. The less force you put through your bad joint, the less it will hurt. Injections. Your surgeon may offer you various injections. These include steroids like cortisone, which is a powerful anti-inflammatory, or hyaluronic acid, which is a joint lubricant, or protein-rich plasma, PRP, which may decrease inflammation and decrease pain. And you may even be offered stem cells, which have the potential to regrow some cartilage. You should have a frank discussion with your surgeon about the options and, most importantly, discuss the evidence for a specific treatment. These injections can be costly and may not be right for your stage of arthritis. There are also ways to take the stress off your joints too, using a cane or a walker or even a brace to your joints. All of these are really good options. There are also lots of tablets that can be helpful in reducing pain and allow you to do the things you want to do, like walking, gardening, and sleeping, as well as exercise. These are medications like non-steroidal anti-inflammatories. Examples of these are ibuprofen and naproxen. You have to be careful when taking these as they can cause stomach, kidney, and breathing issues. We don't recommend taking them without your physician's advice. They are not a long-term solution for pain relief. There are other painkillers called opiates. These are cousins of a drug called morphine. We strongly recommend you do not use opiates for arthritis pain relief. Joint recovery is your daily, at-home, physio-guided rehab program. You'll get 30 days of videos, one for every day of your first month after surgery, to get you to be your best self as soon as possible.